It's Anna from the Mindful Breastfeeding School, and I am talking to Carmelle Gentle today. Carmelle is a midwife. She's an IBCLC, a tongue tie practitioner, and an author. She is the founder of Gentle Births and Beyond, the Tongue Tie Academy, and also the Tongue Tie Centre. I have a feeling I could add a bit more to that bio, but maybe I'll let you introduce yourself as well, Carmelle, and tell people a little bit more about what you do.
Thank you, Anna. Thank you for having me. And you summed it up pretty well. I am a midwife, been a midwife for over 15 years now. And I specialised in tongue tie division and assessing for tongue tie about 8 years ago. And so I've been doing that. Started in the NHS and then kind of went on to work privately and supporting families in their own home. And in the past 2 years, I've kind of just been observing how many more families that I'm seeing who are suffering and kind of finding challenges within kind of their feeding journey, and felt like I needed to do more. So about a year ago, I started training other practitioners and anyone else who was really kind of working with the dyad in those early kind of days, weeks and months. And as on the back of kind of training, the Tongue Tie Centre has evolved, which from a private practitioner perspective, I was really conscious that I wasn't available to everyone, because not everyone could afford to see somebody privately. And so there was this big pull to try and provide a space for anyone who needed it, irrespective of their means to pay. So that is where the Tongue Tie Centre has really kind of filled a gap, actually, a gap in the kind of knowledge, in that we're kind of training other practitioners, but also the financial barriers that are there for families who may either they've kind of exhausted their finances because they've seen practitioners privately in the past, and now they're like, things are still not quite right, they still need more support, or they just would not have been able to afford to see somebody privately in the first instance, nor wait sometimes up to 15 weeks on a NHS waiting list. So it's really helped to fill a gap. And you know, the amount of families we've been able to see in the last only 9 weeks, you know, currently that we've had it open is incredible. We've had over 150 referrals to the centre, and we've seen most of those people.
That is just absolutely incredible. And I do want to ask you more about that, but I just think for anyone because I'm surprised sometimes, I think when we are in this world, we forget that not everybody knows what we're talking about. So just for any parents who might be listening or health professionals who aren't aware, would you mind just sharing what a tongue tie is?
Sure. So underneath our tongue, everyone will have a frenulum, which is, it kind of is like a string or a band that in what it appears to look like. However, it's much more dynamic than that, the structure underneath the tongue. And where that kind of band may be restricted or shortened in its length or inelastic, it can impact the way that we're able to move our tongue. And so for a newborn who's trying to feed, that can impact the way they are, if they're latching, how they're able to achieve a wide and deep latch. And it can present with lots of other symptoms for both the parent and the baby. And so I see newborns, infants up to 12 months who may be experiencing challenges with a tongue tie, or something's going on with their muscular structure around the tongue, which then impacts the way they're able to use it. So it's trying to identify what I'm seeing and what's happening with their feeding, and trying to address the underlying root cause.
Yeah, so what I'm hearing from you there is it on the surface, and some people might understand it as just a bit of skin, and if it's too tight we could cut it type thing, but it's actually a lot more to it, to the sort of, first of all, assessing, you know, what is the tongue tie? Is there a tongue tie, and is it actually making, you know, is it actually impacting, or is it something else? You know, is it the muscles, is it the tissue around it, and also what impact is it having on that baby and also the parent as well? Because some babies are feeding okay, aren't they? But they might be causing a huge amount of, I mean, they might be getting the milk they need, I should say, but they might be causing a lot of damage, or they might be slipping off, or might be having, just generally having a really tricky time. So it's quite a skill, isn't it, to be able to really assess all of those things properly to make a right decision for treatment.
We have to look at the whole picture. You know, we can't just say, which comes up quite a lot, is, oh, baby's gaining weight, they must be fine. And that, you know, weight, and I say it 100 times, like, weight alone is not an indication that feeding is going well. If that baby is, say, slipping down on off their latch, then they could be causing, they'll have to compensate. So, you know, however they're trying to compensate for the latch will possibly present as a symptom such as pain or excessive air swallowing because they're no longer wide on the latch. And so we really have to look at the whole picture. You know, really, we have to physically assess the baby's mouth. So put our fingers in their mouth and see how well they can mobilize their tongue through doing some exercises with them. And then assessing the latch, whether they're latching or if they're taking a bottle, you know, it can impact either. So we really want to fully assess the feed and assess their swallowing, assess how they're breathing, because when the tongue is impaired, when the tongue function is impaired, it can impact their suck, their swallow, and their breathing. And if a baby can't breathe when they're feeding, they're going to have to. So they're going to change the way that they're latching in order to compensate for that. So it's some of the signs that show up can be very subtle to observe, and so that in itself is a skill, being able to assess the subtle signs. And then the other one is actually actively listening to the concerns that the parents are having, because they're telling us the symptoms.
Yeah, absolutely. And it's amazing what some parents, breastfeeding parents, struggle on with, isn't it? Like, you know, sometimes I think of the classic times when I see people who are sort of, it's having to be so managed, like they're almost having to hold their baby on their breast and hold their breast, and then they can't almost move throughout whole feed for their baby to get the milk that they need. And they've just sort of perhaps not even realised that that was not usual and not how it's supposed to be.
They get almost like they contort themselves into this position and not end up like this, and then like, oh yeah, baby's, and then they can't move, because the moment that they move, especially where there's a lack of mobility in the tongue, the moment they move, the baby's kind of alters the latch, because then they can't keep hold of it. And so they're tight, but then they're so used to being tight that for them that feels normal. But the other thing that they do get used to a lot of the time is pain. And so when I'm hearing that, oh yeah, it used to be painful, but now it's not, but their nipples are lipstick shaped, they're purple from bruising, they're squashed, misshapen, then in my mind, well, that should be painful, but they're not feeling it as pain anymore. So they've just got used to that feeling over time. And I guess, you know, in order for them to kind of carry on, they have to, you know, our body, our mind has a way of helping us to do so. And so they do kind of push through it, not realizing. And if there was a tongue tie, say that did need dividing, they'll be like, oh, it doesn't hurt anymore, because it feels so different, and then it feels no longer squashed, and it feels free. So it's just, and as a practitioner, that's where we see the signs. So although they're not feeling it as pain anymore, but if we can identify, well, but your nipple shouldn't look purple, it shouldn't look squashed in that way, what's going on to cause that? And you can understand why.
And the other one that comes to mind is that sort of classic on and off, like although the parent may not be having to hold them in a certain place, that baby's just constantly slipping on, slipping off, they're having to relatch. And of course, in the beginning, it can be a bit like that, you know, having to learn how to latch, but there's something a bit more, isn't there, when a baby can't quite use their tongue properly to open wide and get good, you know, get a good latch on the breast. It can just can take a lot of time, I find, for parents when they're struggling with that, and you know, trying to ensure the baby gets enough milk. And those babies might feed really regularly or for very long periods of time, and I just think that that's just incredibly challenging and hard for parents. It just can take up so much of their day, can't it, feeding?
Exactly, and it becomes much more taxing physically, but also emotionally and mentally as well. And you know, I definitely see that impact on them, their mental well-being. I've had parents who've struggled both with latching and bottle feeding, and very recently a couple who they've had all these symptoms that have kind of come up in their feeding, and they kind of gone down a reflux route, and they're looking at reflux, and things are still no better despite maybe being on medication or having intervention there, and their pediatrician has kind of called their husband to question their mental health, because they're expressing that something's not quite right, and they're not being listened to, and that's when when we're doing them a disservice, because they know, and that's why I say all the time is, we know when something's not quite right. We might not know what it is, but we know intuitively something's not quite right with the feeding. We know our baby is best as well. We're with them, we're watching them, observing them each and every day, and it's kind of really trying to trust that instinct that is coming up, and because we know, and we need to kind of lean into that a bit more, I think. But I think where everyone's got different opinions, like healthcare professional wise, or there may be conflicting information going around, that kind of chips away at that confidence that we have, or that knowing that we have about our baby. So it's just trying to find the right support, which is hard in itself, in the world of many practitioners.
And you're so right, that listening aspect of supporting a family is so important. And I mean, we know that health professionals, you've been a midwife in the NHS, and I've worked in the NHS, not in this role, well, a little bit in clinics, but we know that the time is short. We don't have necessarily, as health professionals, huge amounts of time to spend listening to parents' concerns. We look at the situation in front of us, and then we kind of make judgments ourselves. And what I love about being an IBCLC is that I am able to give my clients time to actually tell me what's on their mind, and give me a lot more detail, and sometimes for families, they'll say to me, I'm the first person they've actually been able to talk honestly with. It may not even be about tongue tie, it could be anything, it could be about their birth or whatever they've been going through over the last few weeks or months. And I think it's such a great part of our role, isn't it, that we can give that kind of emotional support. I imagine that when people come to see you, whether it's privately or in your clinic, that it's not just the feeding, the release of the tongue and things improving. There is a big improvement to their well-being, their mental health as well.
Totally. I think most of the consultation is listening, hearing their story, hearing their birth story, because there's often some kind of trauma that kind of, or just that they actually maybe even haven't had the chance to talk about it yet to anyone, and then if they're then having challenges in their feeding, that's just a whole extra layer which they haven't really been able to deal with. And so, listening is a big part of the consultation, just hearing, holding space for them. And that is in the feedback, it's, thank you for listening. Thank you for hearing, what I've been going through, and validating my concerns. That comes up a lot. And I think, there's much more support that could be done just through sitting and not having to physically. I think as practitioners, it's all, it's almost like, well, we have to be doing something. We have to do something to kind of fix things, or tick the box. And there's no tick box, when we're supporting our clients, because it's every single family that comes through the door is going to have a different experience and a different story. Although some of the themes around the feeding might be similar, it's so individualized. And so it's really just sitting back and listening and affirming what we're hearing, and validating their concerns, because it's their journey.
Absolutely. Yeah, I think it's such a big, it's a big part of what we do at the Mindful Breastfeeding School, isn't it? We do have tools for relaxation and for calming your nervous system and that stuff, but actually that listening aspect of of having somebody that listens to you and believes what you say actually as well, is it's just, I don't know, I just think it's the essence of humankind, to be honest with you, that whole being seen, excuse me, the being seen, heard, understood. It sounds so simple, but yet you're right, it is something that there is a lack of in a lot of the support that we get. And I know, as well as a health professional, my default definitely used to be go in, find the problem, fix it, be the hero of the day or whatever, and that's great. But actually, they're having that holistic approach where you are seeing the whole family, the dyad as a whole, and then just you're almost on like a journey with them, because we don't always get it, we don't always know straight away what the issue is, do we? We don't always we can't always help in the situation. Sometimes it is a bit, well, why don't we try this and see where that goes, and then if that doesn't work, maybe we can go this way, and keep communicating with me and letting me know how it goes, and then we can maybe make adjustments. I mean, that's sort of, I don't know if I'm making much sense here, but that's sort of more I see the side-by-side journey of practitioner and client, is just supporting them in that way, and all the time just with that knowledge of they know their baby best, and they know, and they're there all the time observing, so it's for them to tell us what they're experiencing.
Exactly. And I know we do have the time factor on our side, but I think not having that, say, in an NHS setting is not reason to not listen or to hear. I got a kind of random it was a kind of message from like 15 years ago, and the reply I saw, and she said, "Oh God, I'm so glad I found you. You saw me about 15 years ago, and you came in. I was on a night shift, and she said you came in. It was like 2 o'clock in the morning, and you were able to." I wasn't with her very long, but whatever support I gave her at that time was enough, and she was able to feel like she could, I added value to her learning to breastfeed and to establish her feeding, and she was able to feed for however long after. But she remembers that moment as being a turning point, whatever I had done in that time, and it was 10-15 minutes of my time. And I think even we can make small gestures. And even if we just sat for 5 minutes on a busy, postnatal ward or labour ward, just giving 5 minutes of our time, just actively being there, being present in the moment, not thinking about the, checklist that we have to go through, or the medication round that we have to do next. It's actually just giving that client that space in the time that you have with them, and being fully present in that moment.
Yeah, I totally agree, and I know there are lots of wonderful health professionals out there that do make that time and space for their clients and patients, and but it'd be nice if it was more of a cultural thing, wouldn't it? That was kind of more, that was valued above, I don't know, results and how many tasks can you fit into your shift, or whatever.
Or the next.
Nice.
I know it's so hard. Like it's hard, I guess, being out of that role anymore. I can't even imagine how I would be doing what I'd be doing right now if I was still there. But it's just, I know it does work also. It can work, and so it's a culture. It's fostering that culture, and within the, I guess, even from a student nurse or student midwife level, that it's part of the normal culture. But I guess when they're coming in and this is the way that the system is running, and there's it's like, okay, we need a bed, and it's this kind of conveyor belt approach to care sometimes. It can it has its challenges, so it's what we can do individually as a practitioner, and it's taking that responsibility, because we can't change the system. It is how it is, but as an individual we can make big changes, even if absolutely it's small tweaks.
Yeah, and you are making big changes. And I just wondered if, I think people are probably getting a sense of what it might be like to train with you, but I'd love to know a little bit more about, your courses and, a bit about your approach when people come to train with you. What exactly are they learning to do?
So I have two pathways. I've essentially, I am training practitioners, lactation supporters, healthcare professionals, and birth keepers. So people who will be within that kind of early postnatal period with families to understand how the tongue functions. The tongue is the biggest organ, muscular organ in the oral cavity, and it's the most undervalued. And so when we understand how it works, and not just looking for tongue tie, but how the tongue is actually working, we get more knowledge to know what symptoms may be showing up in the feeding. So actually learning to assess tongue function. And from a tongue tie perspective, we want to know, is this a true tongue tie? Is it muscular tension or is it fascial restriction? We have our tongue, and then we've got all the surrounding structures around it. And so we need to know how they work in order to support the baby. And so we are learning that, and it's creating a holistic 360 approach to tongue tie or tongue function, because when babies have a tongue tie divided, they still need to learn how to use their tongue.
Yes.
And so we need to help re-educate the muscular structure around it. And we can do very simple intraoral exercises, facial massage, to help with that re-education process. And then also looking at rhythmic movement for the babies. So it's what's going on up here in their mouth can also impact how they are in their body, and a lot of the kind of restrictions can, you just see it's a whole system, and it can impact them in other areas. And so through helping them through movement and releasing an fascial tension throughout their body, that can impact and positively change the way that they're able to feed. And so and then we kind of incorporate other professionals in their field who will just talk about the long-term impacts of say tongue tie or muscular dysfunction, and also how other things like osteopathy, cranial osteopathy, chiropractor, and myofunctional therapy, who treat older children and adults, and they often actually see the impacts of when those restrictions have not been treated early on. And so they're looking at it from an older child perspective. But it's great to get their knowledge and wisdom around that, because actually it just hones in, how key it is to assess it early on when they're newborns. And it's actually also kind of stresses the importance of a team approach, which we don't really have here really in the UK. And I kind of look at what they do over in the States, and how they, it's, and I think it's whether how their insurance might work, and it's, this is who you need in your team right now, and they get signposted to the right people, whereas it's very fractured here, and we don't have we need to search for those support people, because you might go to an osteopath, but I know in the States, they might have an osteopath, they may have the kind of physio, like OT, they have like different kind of names in the States. I get them wrong, but they have a whole team approach around it. And so they think they then it's all inclusive, where we have to try and figure out. So I'm trying to bring what I can bring in to do what we can do as practitioners to help them pre and post tongue tie division, and then I've got those who are healthcare professionals then go on to learn actually how to do frenulotomy. So that's the process of cutting the tongue tie. And so they're getting to see it all in action in the clinic space.
That's amazing, isn't it? Because I know I've got quite a few colleagues who are friends who are tongue tie practitioners, people I've worked with before, and there's you know, traditionally in this country there's a couple of places I think that teach, and there's like a long waiting list, and you sort of go into the hospital when you run these sort of quite busy, you're in these kind of quite busy and I've worked in tongue tie clinics, they're a bit conveyor belt, tend to be a little bit perhaps that's trying to be kind. They're very, you know, I've really got a lot out of working there. I've really learned a huge amount, and I don't cut tongue ties, but I do the breastfeeding support and support afterwards for the family. So but it is quite, you know, because there's so many babies with tongue ties that you know, they have to try and fit them into these very small clinics. So yeah, it is a bit of a conveyor belt. And I think but yeah, lots of colleagues have sort of told me about the training, and it's taken them years to get onto a course, and then when they do, it's quite well, they certainly wouldn't have access to, you know, sort of the knowledge around the fascia, around the, you know, around the muscles so much. Obviously you do have to know about you have to know a lot to become a tongue tie practitioner, but it doesn't sound as, I suppose you trained here.
I did it. Yeah, I did mine, and you know, I am very grateful for the training that I did have, because it's where I am today. But it was a one-day study day, and that's how it typically is in the other training providers, and then it is literally see one, do one, which is how we learn in nursing and midwifery, and you know, that is how we learn. But what I come to realize is that it's not just about the division. You know, once that tongue tie is divided, there's so many babies, and you probably hear it and see it as well, that, well, we've had the tongue tie divided and feeding's still not quite right.
Yeah.
And that's where we have to understand, you know, what's going on, because actually you've got the tongue ties divided, you've also got wound healing. So you need to understand that process of wound healing, and then incorporate the muscular change around the tongue that's now free. And so, yeah, it's totally, so I've tried to bring in everything that I didn't get. Because I'm like, we need to know this is, you know, we families are, you know, you do get those babies where, okay, you know, they just had that tongue tie division and that's all they needed, and they're off and they're on their way. Whereas majority, it's a journey, it's a process still afterwards. And so the clinic, and if I think back to when I did my training, it was, you know, it's C1, do one, baby's latched, bleeding stopped, off you go. Whereas families here, that it's about a 2-hour appointment. It's quite a long appointment process, and again, a lot of that is listening and hearing and giving them that space. We do the procedure, and then it's that support after to just ensure that their latch is optimal, or their bottle feeding is optimal, and then we're looking at then integrating the different exercises that we want the family to try and go home and continue to do. Yeah, it's a great space, if I must say myself. It's really evolved, and just hearing the stories and the feedback from the families that are coming here is just like, wow, I created this.
Yeah, no, it's something you should be very, very, very proud of, and I'm sure everybody who's training with you and able to come and, you know, work with you alongside you in that manner is just, you know, absolutely loving it. And I'm sure they're going to go off to be incredible practitioners, and then also to know that you're there for their support, you know, and ongoing learning, I'm sure as well. I think that makes such a big difference. I could talk to you all day, but
and so I'm still on the waiting list for one of the hospitals where I was training. I was like 8 years ago, because they have such a long waiting list, but you know, I think it is what it is, right? And that's how it is. And there's space, there is space for more, and that's always, hopefully can make some change, and we can impact. You know, I recognize I couldn't do it all by myself in the one-to-one clients that I was seeing, and I thought, okay, well, I need to train more people so that we're all on this similar way of working in this holistic approach, because that's, I think, in everything, you know, in wellness, when we think about like health care, you know, I think there's so much of, okay, this is a symptom, here's the treatment, and in all, you know, across the board. And I think it's such an area where we're dealing with the most vulnerable of society for babies, and the new parents who are equally vulnerable after giving birth and in this postnatal period. And I think if we can just meet them where they are at, and, you know, just be that soundboard for them, we're going to make life-changing, our support is going to be life-changing. And I think, you know, they'll look back at this time and hopefully, you know, really, I guess, hopefully value the time that we've given them, where it wasn't rushed, it was individualized, and hopefully we reach a resolve to their feeding, however long that takes.
It's just so great to speak to you about this, because I've been IBCLC for 6 years, and before then I was working a little bit, well, in our local clinic. And I think so many parents, I'm hoping that people that listen who might, you know, have had a baby tongue tie or might be, you know, struggling with it now. I think often these parents have struggled often for so long and not got the answers they want. Like, they'll hear things like, oh, it's a small tongue tie, or yeah, there is one, but it's not impacting your baby, or like you said, the baby's putting on weight. And I think often then they maybe get an appointment, have it, you know, to have it cut. And I always, if I seeing family around this time, I always try and manage their expectations and say, look, it isn't just a cut and then it's done. Like, it is a bit like there's a lot of relearning. Like, I love that word you use, integration. That's a great way to describe it. And I think it's really important that and I think hopefully that's anyone who's listening to this today really gets that message, that it's not just a snip of a piece of, you know, of a frenulum and that's it. There is work to be done. There's work to be done from the parent side. There's and it doesn't have to be hard. It's just, it can be fun, but they need to have the knowledge and the support so they know what to do and how to support their baby after the procedure. So I think, hopefully anyone who's listening today really kind of gets that message and understands there is more to it than kind of just, you know, getting out a pair of scissors and snipping away. So it's been a really valuable conversation, Carmelle. Thank you.
Oh, no problem at all. You know, there's more to come. You know, there's more work to do. As I find myself like, okay, this is how to happen next, and so it will be evolving. And I'm really looking forward to the next year and what that's going to bring. And hopefully, you know, support more students and support more families at the same time.
And if people want to find you, whether they're a parent who likes, you know, is interested in the sound of your clinic, or if they're a professional that wants to come and train with you, where's the best place to come and find you?
The best place at the moment is on Instagram at Gentle Births and Beyond. You wouldn't believe I was never on Instagram before this year. Now that's where I am. So at gentle_births_ and _beyond. We'll
put it in the notes, so don't worry.
It's but yeah, so that's where I am at, and you can put my email address below if you choose. Yeah, and that's where they can reach out, and any questions, any concerns. I've got the tongue tie hub for professionals over on Facebook, which you know is a place where, again, there are Facebook groups for parents and tongue tie, and then there's a Facebook group for practitioners who are tongue tie practitioners, and so I thought, well, actually there's a whole load of other practitioners who are supporting families. Let's bring them together. And you know, I do try to go in there. It will be more regularly in the new year now, just every month, just with someone, an expert in their field, to come and discuss whatever it is that their specialist interest is, and hopefully just give more insight to how we can support our families, where to signpost them. And yeah, you've been in there doing
I've been in there.
So, yeah, it's
always happy to come back. I love it. It's a lovely space, and there's just so much. I love the depth of learning in there, and it's so yeah. If anyone does find themselves working or supporting families with tongue tying, you'd love to know a little bit more. Then yeah, Carmelle's free Facebook group is just a really nice place to be. So yeah.
No, thank you. But yeah,
Oh,
I could talk hours and hours.
Yeah.
So.
I could. We will wrap it up today, but I would love to have you back because I think there's a lot more we could talk about. We haven't even mentioned mindful breastfeeding really, so you can talk about that one day as well. But yeah, thanks so much, Carmelle, for joining.
Thank you so much for watching. I really appreciate your spending your time here. If you'd like to know more, a good place to start would be with the Mindful Breastfeeding book. It's available from Amazon around the world, and it's a short interactive guide to mindful breastfeeding with journaling and guided relaxations and just more talk on the importance of having a calm and connected infant feeding experience. You can find our website at www.mindfulbreastfeedingschool.com. The link is below, and on there you'll get access to our practitioners directory. So if you as a parent and you'd like to work with somebody who's trained in mindful breastfeeding skills, as well as all the practical skills as well to be able to help you on your infant feeding journey, then you will find someone you can work with there. They also run classes as well as one-to-one sessions, so go and have a look around. And you can find access to our courses. So if you are somebody who would like to add mindful breastfeeding to your practice, then please do come and find our courses. We've got free training on there for professionals and birth workers, as well as access to be able to talk to me. So do leave me messages, do get in touch on social media. All the links are below. I look forward to hearing from you.